Hi, good afternoon. This is the Youth Quality Assurance number 5 video, the last one. My name's Hudson Hill. These videos come to you from a Zoom team, a Youth Quality Assurance Zoom team that includes Bridger Fates, me, Hudson Hill, and Shar Perry. So as we get going today, we're going to do a little review about the quality assurance and the quality assurance classes to make sure that we're remembering the classes we've taken in the place and why we come to these and do these classes and videos. Of course, many of our fairs throughout Wyoming require that we take the class in order to show and sell it ourselves. But the reason we're doing it is so that we understand how we can bring the best product to our fairs. So what is quality assurance? If we answer that question, quality is an interesting word. You know, it's really a judgment, but in this case, quality really is talking about safe, healthy, and good tasting products that 4-H members, the producers, are bringing to the fair. An assurance, basically those 4-H members are making an assurance, which is a promise or a pledge to consumers that they've done what they can do to make sure that that product is of quality. So the quality assurance, the promise that our 4-H members are giving is that food from our livestock will be the highest possible quality, and we will do everything we can to make these products safe to eat. So we have to remember 4-H, we have to remind 4-H youth that regardless of how many animals they raise, what species or breed, you are producing food that will end up on someone's table. It's interesting to talk about, no matter what class we do, no matter what county we do this class in. You know, our fairs, our livestock sales at fairs really provide a lot of food in that county, and it is important for 4-H members to remember that they are producers and they are producing food for people to eat. So why do we worry about quality assurance? We really want to be able to improve food quality. We want to improve consumer confidence in the livestock industry. We want to improve care and management of our animals. We want to increase product value. You know, it really is the right thing to do for our 4-H projects to make sure all of those things are happening. So our 4-H members, we really encourage them to understand and think about, if you raise livestock, you are producing food. Everyone involved has to accept responsibility. We all need to continually keep learning about and improving our practices that can affect the quality and safety of our food products. So what you can do, you can help and work on the safety and quality of the food supply. You, as 4-H members, can work on consumers' image of the livestock industry and also the image that people have of youth livestock programs. Really, all those things are happening when we're talking about youth quality assurance. So here's the first set of questions. Now that we've gone through our review, these questions come from multiple years in the past that you've gone through and thought about and listened. So number 1, who is responsible for quality assurance? Hopefully everybody got that. The producer is responsible for quality assurance, and it's really important for 4-H members to remind themselves with their livestock projects that they are the producer. They are responsible for quality assurance, whether it's medicine, whether it's feed, whether it's water, whether it's management. All those things are the 4-H persons, the producers, the 4-H person, the 4-H member. It is their responsibility. So number 2, name a type of animal ID. We want to be able to identify our animals. We want to keep records on our animals, and we'll talk about that a little more here in a minute. But there's lots of different ways to have animal IDs. There's brands, there's freeze brands, there's neck chains. Most of our animals will have a ear tag. There's ear notches. There's multiple different ways to have to be able to identify our animals. So number 3, list something you can find on a feed tag. You know, this comes clear back from the first class you took 4, 5, or 6 years ago. Something you'll find on a feed tag would be a list of ingredients. You'd be able to find how much protein's on there, how much energy's there. You might be able to find some minerals, and something you would be able to find if the feed was medicated. You would be able to find the medication on the feed tag. So any of those things would work as you list something you'd find on the feed tag. Number 4, true or false? Withdrawal time is not important. Of course, we know that withdrawal time is important, so that would be false. Withdrawal time is really talking about drugs, and we're going to talk about that a little more in this presentation. But withdrawal time is really how long the drug would stay in the animal, and how long we need to wait before that animal is slaughtered after we give our livestock projects an administration of drugs. So number 5, how many days can an animal go without water? So several years ago, we talked about feed and water. We know that an animal can go without water for 1 to 3 days. Of course, with our 4-H livestock projects, we wouldn't want them to go at all without water. We want to always supply our livestock projects with clean and adequate amount of water. So that's the first set of questions, and we'll move forward here with the 5th lesson in youth quality assurance, medications and animal health products. So as we go through this presentation, we're going to focus on about 4 areas. The first area is records. The second area is being able to store and label our medications correctly. The third area is going to be how and what we should be doing to work with our veterinarian. And then the 4th is proper administration, how we actually give the animal shots. So the first one, records. We want to be able to maintain medication treatment records. Record keeping can be simple. Just each time you treat an animal, write it down. There's an acronym that we like to use. It's calculate. So when we look at this acronym calculate, the C stands for calendar, the A stands for animal, L stands for label, C stands for calendar again, U stands for you, the producer, L stands for the location, A stands for the amount, T stands for type, and E stands for extra. So I'm going to go through each one of those letters in this acronym and talk about how, as a 4-H member follows these, how it'll help them keep adequate records for their 4-H project. So C, calendar. We want to check the calendar and record the date that a medication is given. If we give an animal drugs, if we administer drugs to an animal, we want to be able to write down on the calendar. We want to be able to keep record of what date that was given. Pretty simple. A, you know, most of us have multiple animals in a pen. We want to be able to make sure that we record the animal. We want to record the animal's identification. Might be an ear tag, an ear notch, a tattoo or other, but whatever it is, make sure that we are keeping track and we know on what date, what animal was given the drug. So the L, the label. When we're using drugs, that label is absolutely essential. We want to read the product label and record the product name. We want to read the label so that we know everything about how to give the drug and what it's going to do. But we also want to read the label so that when when we keep records, that we can put the product name down in our records. So calendar comes around for the second time. And the reason the calendar's there twice is the first time we wrote down when the shot was given, but we also want to write on the calendar, after we read the label, we want to note and record the withdrawal time. So check the calendar again and record the date the withdrawal time will be over. We'll know from the label how long that withdrawal time is on that individual drug with that animal. And so we actually want to do the calendar twice and write down what date the withdrawal time will be over. So U is you. Make sure we record who gave the medication. Whoever administered the shot or gave the animal the drug, we want to make sure to record who that was. So L for location, we want to record the location where the injection was given. Here's an example, the right side of the neck. This injection was given in the right side of the neck on this date. A stands for amount. We want to record the amount of medication that was given. It's usually in cc's or milliliters, but make sure that we know how much the animal was given on that date. So how much is too much for our animals? For cattle, any one injection should not be over 10 cc's. For smaller animals, follow the label, or no more than 5 cc's per site. So in some cases, we may need to give more than 10 cc's or 10 mils to our steer. If we did that, we'd give the shot in 2 different spots. So T, the type. We want to record the type of administration. This is talking about the type of administration, how the drug is administered to the animal. You know, sub-Q stands for subcutaneous or under the skin. IM stands for intermuscular. Oral, of course, that would be giving the drug orally, and etc. We want to be able to, in our records, keep track of how the drug was given to the animal. And E stands for any extras. We would record any extra information such as symptoms. You know, the calf might not feel good, it might have an upset stomach. If the calf's running a temperature, we would also want to record if we knew the weight of the animal. And if it was a prescription drug, we want to name the veterinarian if it's a prescription drug. So maintaining medication and treatment records is important. There are different forms available from PQA, Pork Quality Assurance, or BQA, Beef Quality Assurance, and other programs, but you can just make your own. Just make sure that you include all required information. And again, think about that acronym, and you'll remember the required information, because the required information includes the calendar, what date the medication was given. Make sure that you can identify what animal the drug was given to. L, we want to read the label and make sure that we know the product name and how to do everything the label says. We do calendar twice because we want to make sure to record in our records the date the withdrawal time will be over. U is the person giving the medication. Keep track of who actually administered the drug to that animal. The location of the injection, we may need to give the animal another shot later. So if we know where we gave the shot the first time, the right side of the neck, the next time we give it on the left. We want to know the location of the injection. The amount of the medication given, so we know how that drug worked and how much was given at any given time. We want to know the type of administration. We want to make sure on the label we looked at how and what administration should be used. So we either do sub-Q, IM, orally, and we keep record of that. And then any extras, you know, write down the vet that gave the prescription or any other information, such as if the animal was running a temperature or didn't feel well that day, or maybe even how much the animal weighed. So remember that acronym, calculate. So as we administer our health products, we can follow some steps. Step one, follow what you read on the label. The label is really important because it's going to tell us everything we need to know about how to use that drug. We want to make sure to use the correct type of administration. We want to be able to use the correct amount. We want to make sure we know withdrawal times. Step two, educate others in your family. If you're giving an animal drugs, anybody who's helping you or around the animal should really understand why you're giving the drug, what it's doing, and how long the withdrawal time is. So as we're doing proper administration, there's lots of things to think about: treating animals, selling animals, withdrawal times, proper administration. And so all those things are really important. So when we talk about proper administration, we're talking about the actual procedure of how the drug's going into the animal. And the first one we'll mention here and talk about is subcutaneous. A lot of our drugs are subcutaneous, sub-Q, and it means underneath the skin. It's important to understand that these drugs have a chemical makeup, and that chemical makeup is really important to do certain things within the body of the animal. So the way that chemical is made up, if it tells you to do it under the skin, that is the best way for that chemical, that drug, to be absorbed through the body. And lots of time it needs to go under the skin because what it does for the animal is really good, but it might be too tissue toxic to actually go in the muscle. And we have a picture of that here in a little while. You know, if it says to do it in under the skin or in the muscle, make sure that we do that because the chemical makeup decides how that's best to go into the animal. So number one is subcutaneous, sub-Q. Number two is intermuscular, or IM. It goes in the muscle. You know, if you're doing it in the muscle, you probably want a longer needle. If you're doing it under the skin, you probably want a shorter one. If we're going into the muscle, we're going through skin, probably some fat, and then into the muscle. If we're just doing sub-Q, all it needs to do is go through the skin. So the length of the needle is probably important. So when we think about proper administration, all sub-Q and IM injections are giving in the front shoulder in all species. We never, ever give a shot in the rump or the hind leg. One exception to the shoulder rule might be a young pig, a small pig. We may give a sub-Q shot under the skin in the elbow pocket or the flank. We'll show a picture of that here in a second. But this slide is just to make sure to remind you, never give shots here. They're always up in the neck, no matter what species it is. And sometimes it is actually easier to give a shot right here on some of these animals, but we give it up in the neck for a couple of reasons. The main one being, remember, this is a quality assurance class. This is the best way to make sure that the most expensive meat, the important, is taken the best care of we can. And we always give the shots up here in the neck. So here's an example of the location of an injection. The leading edge of the shoulder, we can see here in the red line. The shot needs to go in front of that. And usually the sub-Q area is just a little bit further back here where the skin folds up. There's a little more skin right here in front of that leading edge of the shoulder. And then there's a good muscle just a little bit further forward. They're not very far apart, but there is a little bit difference where we give the sub-Q and the IM shot. And again, here it shows you that on occasion, a sub-Q shot may go in the folds of the skin on a young pig. So this slide is really to help us understand that proper administration is really important. There are consequences. There are potential consequences of improper administration. You know, we can have drug residues. If we don't give the shot right, drug residues may stay in the body longer than the withdrawal time. And really, since we're talking about quality, injection site lesions and abscesses are a real consequence of giving improper administration. And, you know, improper, we can do it in several different ways. We talked about making sure that the drug was administered properly. Also make sure we use clean needles. We don't want to be pulling back bacteria into that muscle with us. But here's two pictures where we can actually see a lesion and an abscess. You know, this right here is an infection in the muscle, and you can see that the muscle is, the animal is walling this infection off and fighting the infection. Of course, we don't want that in our meat, do we? This one is a really interesting picture. You know, here's a lesion, and we can see that the shot was given right here, and it came in, and the drug, through gravity, went down through the muscle here. In this particular case, it was probably a drug that should have been given sub-Q. It was a little too tissue toxic, so it actually came in here and it actually destroyed the cells in the muscle, and it created a scar. You know, that's basically a scar inside of the muscle. And, you know, of course, that is not quality. That's not what we're basically promising producers that we would do. And in both cases, these could have been prevented if we'd have just followed the directions on the label and done things right. So here's a little video. You know, over the years, giving a shot to an animal can be a little bit stressful. The first couple of times we do it, we don't necessarily know how to do it and whatnot. So, and everybody, pre-vet students, everybody practices before actually giving a shot to an animal. So here's a little video that'll show you how to practice giving shots.
All right, so we've talked about the different types of shots we can give our animals. There's in the vein, which you guys will probably not have to do, in the muscle, and subcutaneously, which is just through the skin. When you do that, we want to remember the spot that we give them is the triangle on their necks. Pigs, the only other spots we'd probably ever give them is in their armpits. But other than that, we're in the neck. We don't ever want to give them in the hindquarters. Who knows why? It ruins the meat and the quality. Good job. We don't want to have any abscesses or lesions in our meat, so we want to stay away from that area. So it's really important when we do it that we're reading our label. We know how it should be given. If it's sub-Q or if it's into the muscle, it's really important so we don't ruin our meat quality. When we're giving the shots, you want to make sure you withdraw how much air you need and how many cc's you're putting. And then you'll put it into the bottle and you push the air into the bottle, and then that gives the bottle room to suck out your medicine that you need. So make sure you guys do that when it's time. Make sure that we're not giving a huge shot in one location. You guys remember how many cc's we can give in one spot?
On a steer, it's about 10 to a side.
Okay. What about our smaller animals? Do you know how many?
5.
5? Yep, it's 5. So if we're giving our lamb 15 cc's, how are we going to do that?
One in the neck and 2 on.
Okay, so we want to keep them in the necks, but we're going to divide it into 3 shots, right? It's perfect. If you're doing poultry or smaller animals, it's 1 cc. Perfect. So what I'm gonna have you guys do this. When you're giving your shot, you want to make sure you're confident. Don't be scared. Don't go up there and shake. Just when you put it into the meat, into the muscle, make sure you just put it right in, okay? And then you can just, under the skin, you can feel. And so you guys are going to do this. Your bananas are not going to hold a whole bunch. So don't put probably more than 2 cc's, and maybe put 1 cc in the muscle and 1 under the skin. And then when we're done, you get to open up your banana and see how well, if you got it between the skin and in the muscle where you were trying. So try and maybe do different sides when you're doing them. So there's a banana for everybody here. All right. We have different colors so you can see which one you want. Girls, I don't know, here's a red one. Someone wants to do red. There's a blue.
I got red.
Oh, did I hand you blue?
Here, do you want the blue?
Okay. Whatever.
Okay.
Just wait a second. Okay, you guys. So, yep, pull it back to about 2 cc's.
All right, so number 2.
Yep, or 1, maybe even 1. You don't need much. Yep, that'll work.
What about 1.5?
So you're gonna put it in there. Okay, you're gonna tip it upside down, push the air in. Okay, now you're gonna pull the bottom part back out.
How much?
You could probably go to 1. We didn't quite pull it down to this big one right down here. Good job. Okay, stop. So now you're gonna flip it over, pull it out. Okay, and one thing I didn't talk about is really important to check and make sure you don't have air in there. So here, you wanna use this one?
I'm ready.
Okay. So when you flip it up, when it's inside here, you can just kind of push the air back into the bottle in case any medicine comes back in. Oh, there was one, that one's probably plugged. We'll get you a different. They've been used on bananas before.
So,
Okay, yep. So now that you're ready, so which one do you want to do first?
the muscle.
Okay, these are long needles, so don't go all the way through and jab yourself. So just push it right into the muscle. Okay, that's good. Yep.
Now push it off.
Yep. You can push it all or some. Okay. Yep.
Gosh.
That's okay. The bananas don't like to hold too much, right? Okay, so now do the same thing. Fill it up. Smear.
Oh, gross.
Red looks like blood, huh?
Oh, yeah.
Got that one.
Yeah.
Okay, tip it over.
Maybe.
Yep. And then
Holy
you're gonna pull.
Just.
Yep. Like probably a half is gonna work. That's probably enough.
Come on,
Oh,
more.
got it? Oh, that one doesn't work. That needle's a bad one.
Okay. Can I do it right here? I'm gonna put it about like right there since it doesn't hold much.
Yeah, that's oodles. Yep. So now you want
Can
to
we
just
open them up?
try and come underneath the skin. Yep. Now you can open it up.
Food coloring.
Yeah.
Okay.
So just kind of fill under the skin.
Okay. Like that.
Yep. You think you're through it, and then put some in there. Good job.
Done.
How'd you do?
I did pretty good.
Was that for your
Banana?
subcutaneous?
Yep.
And now break it open and show us where your intramuscular one was. See how you did on that one. Looks like, yep, break it in half. See?
Mom, how do I open it? Is this a blue one?
See how it went inside there?
This looks like
Good job. All right, does anybody else need help?
Oh, that.
I really like that little exercise for youth that can really show them how to give the shot, and it can really give them confidence to go out and give a shot. Later that day, we went out and actually gave this 4-H steer a couple of shots, and the second shot was given by the 4-H member after he practiced on a banana. So we'll show this little video of actually giving a shot to an animal. So we're going to go ahead and give this calf a vaccination. We're going to read the bottle. The bottle tells us to give 15 mils in 2 different spots subcutaneously. And so when we read the bottle, we make sure that all that's right. We know how much we're giving and how to give it. So I'm going to give one of the shots, and Jason's going to give his calf the other shot on the other side. So we're going to move around here, and the easiest place to give the shot is right here, or right here. But of course we're not going to do that because we know that we give all shots up in this triangle right here in the neck of our animals. We do that for meat quality because the meat back there we don't want to mess with. So again, this shot is going to go subcutaneous. If it was an intermuscular, an IM shot, we would put it right into the muscle here. It's subcutaneous, so we're going to go underneath the skin. So when we practiced, you know, we didn't mess around, we didn't do any of this. We're going to have lots of confidence. We're going to go right in as soon as the calf's ready. Kind of get the calf used to touching us, and we'll go right in. You know, that video just showed us giving that calf a shot in the proper place, in the proper way. Really practicing a little on some fruit is what pre-vet students do before they go out. And it's a really nice exercise for 4-H members to practice and then be able to go give their own animals a shot. So as we move forward here, we talk about storage and labeling, and we're really going to focus on the label that's on the drug here. It's important that we properly store, label, and account for all medications, medicated feeds, and related items. So we can't stress enough, read the label, read the label, read the label. All drug labels should contain this information: an expiration date, a lot number, the dosage, how much we should be giving, any warnings, and especially the withdrawal times, any precautions that we might take would have the active ingredients, an application method, and a trade name. All those things are important that we can find on the label for different reasons. So some related items, needles and syringes. Disposables are sanitized and easy to use. You know, they're one use, they're clean. They're really great to use. Clean, reusable syringes and needles properly. If we're going to reuse a needle, make sure that we're really cleaning it. If we're going to reuse needles, make sure we're checking for burrs. We want a really sharp needle that'll go through the skin and not cause the animal any stress. And never use bent needles or something that's been used in the past and has any damage on it. So we're going to want to dispose of our used needles properly. There's sharps containers for just that purpose. The next thing that we want to talk about is working with our veterinarian. You know, these drugs are important. They are tracked and used and labeled in a certain way to make sure they're used safely. So in order for us to be able to use them for our 4-H livestock projects, we really want to develop a veterinarian client-patient relationship. We want to know a vet, and we want that vet to kind of know what's going on in our livestock projects. When we're working with a vet, we try to use prescription drugs only when working through a vet. It's important to understand the difference between what is a prescription drug and over-the-counter, an OTC versus a prescription. Why prescription? There is a margin of safety for our animals and people when we're using prescription drugs. And then there's a difficulty identifying disease being treated. When we're working with the vet and when we're getting prescription drugs, there's a margin of safety and we know what's going on. We're working with a professional to get that done. There's types of drug use. There's labeled use. When we're following the label, we want to use the drug exactly as it is specified on the label. Medicated feed may only be used as directed by the label. That's what's legal, and it's the type of use most producers use. We just follow the label and do exactly what it says. There is an off-label use where a producer might use a drug on their own in a manner other than what is stated on the label without a veterinarian guidance. That's illegal, folks. We don't do that. You know, we have to basically follow the label in order to be legal. There is an extra label, however, where the veterinarian prescribes a drug to be used in a manner other than what's on the label. If the veterinarian, you know, basically writes us a prescription and gives us some instruction to use a drug a certain way, that would be extra label use, and we would follow the guidance of the veterinarian exactly. So there's types of drug use, extra label. A veterinarian might encourage us and give us instruction to increase dosage beyond the label. The vet, they might have us change the frequency of the administration. The vet, he or she, may change the length of treatment. They also might change the disease that could be treated. And they might even change the species. What type of animal can be treated with that drug? That's the kind of things that might be used with extra label. And who? Of course, that would be the veterinarian that would do that. So we've come to our second set of questions here, questions 6 through 10. Make sure you're writing these down. Number 6. What is the most medicine you should give a cow in a single injection? You know, if you remember, we mentioned it several times, and then we gave, when we gave the steer the shot in the video, we were giving the shot in 2 different places because it was more than 10 mils, more than 10 cc's. We would only give 10 cc's in any given spot with a cow. And remember, our smaller livestock, that would be 5 cc's. Number 7, where is the best spot on an animal for an injection site? Hopefully you all wrote, there's a triangle on the neck where we give both sub-Q and IM shots. Number 8, what does sub-Q mean? Sub-Q means under the skin, subcutaneous. We give those shots the way that they're meant to be because the different chemicals in the drugs absorb into the body a different way. Number 9, what does IM mean? IM means in the muscle, intermuscular. So in that case, we make sure we probably use a little bit longer needle and put the drug into the muscle itself, and that way it's absorbed into the animal. And the last question, number 10, what does OTC stand for? OTC stands for over the counter. That would be a drug that we can buy. We'd use it over the counter. We really encourage people to use prescription and work with a vet instead of over the counter drugs. Okay, so that's your last set of questions. Hopefully you've got all those. So the assignment for this class is to complete the calculate assignment. You've all been given. So complete that assignment, and after completing the assignment, return it to the extension office to receive credit for passing this level of quality assurance. So again, really enjoyed going through this presentation with you today. It's a fun presentation. The exercise of practicing shots and giving shots is fun and interesting. It's really fun for youth to be able to do that. All of these videos, these YQA videos, were produced by a Zoom team. That team consists of Bridger Fates, who's in Uinta County. I'm Hudson Hill. I'm the ag and hort educator in Lincoln County, and Sharp Harry's with me in Lincoln County there. So again, really enjoyed doing this presentation with you today. Good luck with your fair projects. Let us know if we can ever help you along. Have a nice day. The lawyer.